Welcome and good morning to everybody. Today I am going to discuss the perioperative fluid management, a very burning issue and important also for the perioperative physician, that is the anesthesiologist. Competent perioperative fluid management is of the utmost importance because the intravascular fluid affect all the physiological and biochemical processes essential for life. The goals of fluid management are to provide adequate delivery of oxygen to tissues and to maintain the environment necessary for proper function of the cells and organ systems. Determinants of oxygen delivery to tissue. Generation of flow, that is the cardiac outflow. Oxygen content of blood, preload and hemoglobin are the most often manipulated by the intravascular fluid therapy. A key assumption is that the vascular system, that is the vascular autoregulation and normal endothelial permeability, is intact. Fluid compartments, circulating blood volume make up a small percentage of body weight and total body water. Yet, one should appreciate the profound influences this small fraction of body fluids has on the hemostasis. Estimated circulating blood volume should be compared with blood loss during surgery or trauma. The type of amount of fluid therapy used to treat the blood or fluid loss have a greater physiological effect as the proportion of fluid therapy to circulate the blood volume increases. Now, physiology, variables and blood components affected by the fluid administration, like the temperature. Patients are often hypothermic on arrival at the operating room. Fluid administration can cause or exacerbate the hypothermia and acidosis. Hypothermia and acidosis significantly decrease the platelet function and coagulation factor activity. The moderate to severe hypothermia in severely injured trauma patients is associated with higher morbidity and mortality independent of other risk factors. Now we come to pH. Normal saline has an average pH of 5.6 but can have a pH as low as 4.5. Large amounts of normal saline lead to hyperchloremic metabolic acidosis. It has the less effect on the pH, but large volumes can also lead to acidosis. Now, electrolyte derangement occur with change in the pH, temperature, and large doses of steroid, colloid, and blood products administration. Now, RBC, hemodilution, temperature, and pH affect the RBC concentration and function. Stored PRBCs have lower pH and 2-3 DPG levels, decrease oxygen delivery, and have a higher ammonia, PCO2, and microaggregate levels. Massive transfusion of PRBCs can lead to hypercalcemia due to citrate additive. This is relatively transient, and hyperkalemia due to RBC cell lysis. Platelet and coagulation factor, hypothermia and acidosis often seen with massive fluid infusion. This can cause or further exacerbate the platelet dysfunction and coagulopathy. Certain disease states may cause baseline platelet dysfunction. As for example, uremia, liver failure, preeclampsia, HELLP syndrome. Massive trauma and patients with this disease may be more affected by fluid therapies. Now, albumin. Albumin has important drug interactions and oncotic pressure effects. Pre-existing hypoalbuminemia, hypo, and concomitant third space loss is worsened by the hemodilution effect of the larger infusions. The WBC, the artificial colloids like Hedges charge and LR, the ringer lactate, significantly activate the neutrophil activity and may play a pivotal role in association injury. Now come to the inflammatory cytokines. Blood products and artificial colloids increase the inflammable cytokines. The effect is unclear, but is an area of active research. One common method of perioperative fluid management calculates the fluid requirements needed to meet estimated demands and losses. This method is often referred to as a liberal fluid management strategy. Calculated results often lead to greater volumes being infused than are actually lost during surgery. This approach can help one gain a sense of magnitude of fluids needed during a case. This comes to the end of the session. I will come with newer materials in my next video session. Thank you.